Now, people with breathing and lung issues have enough of a challenge in their daily lives already. Now comes COVID-19, which strikes the respiratory system and makes breathing difficult, sometimes fatal. So what can you do to guard against the coronavirus that the rest of us aren't doing already? 17's Robert Price looked into this, and he has this report.
This is asthma country, valley fever country too. Kern County has almost more cases than any place in America. More than 100,000 Kern County residents have been diagnosed with asthma, no doubt caused by our high rate of airborne particulate matter. And as of last November, Kern County had more than 2,700 confirmed, suspected, or probable cases of valley fever, a lung-attacking disease caused by a regionally indigenous airborne fungus. Throw in thousands of additional ongoing cases of COPD, such as emphysema, and you've got an unusually vulnerable population. Asthma and valley fever sufferers know the COVID-19 drill by now. Wash your hands often and practice social distancing. But they're the ones who really need to abide by those recommended practices. Dr. Amy Mehta, a pulmonologist with Premier Medical Associates, said you may indeed have a tougher time if you test positive.
In regards to treatment options, they are not different if you have COPD or other lung issues such as asthma versus someone that doesn't have any other issues, but you may get sicker a lot faster and you may need to rush to your doctor or go to the ER urgent care if your symptoms worsen a lot faster.
That makes prevention all the more serious an undertaking. Carlos Bello, an asthma educator with Kern Family Healthcare, says asthma sufferers should complete an asthma action plan and follow it. Take their asthma medication as prescribed, talk to their doctor about securing a 90-day supply, and consider mail-order pharmacy options. Also avoid disinfectants with strong chemicals or smells, because those can cause asthma attacks as well. And then he said this.
As more cases of COVID-19 are discovered and if there's a big outbreak in your community, people are going to be stressed out and feel concerned. So keep in mind that emotions can cause asthma triggers. So take steps to help cope with stress and anxiety. And another thing is very important to stay fit and exercise if you have asthma. If you need to go outside and exercise, it's very important to practice social distancing and try to avoid other folks, so that way you limit your exposure.
So if you have lung issues, go ahead and walk the dog, jump on your bike, do some push-ups. It'll help. In Bakersfield for 17 News, I'm Robert Price.